Hello and professional viewpoint. I'm Kay Phillips. Here we tap into the minds of the expert, get the views, experiences, tips, reviews of professionals from various backgrounds to help you make important life choices. Our guest today is so dear to me. I'm so elated. She's a clinical pharmacist, she's a mother, and she's also a wife. I'm so proud of her. She's family. So let's welcome Crystal Jones to the Professional Viewpoint. Welcome, Crystal. How are you?
Hello, I'm well, thank you. How are you?
Fabulous. Nice to have you today. So, Crystal, what does it mean to be a clinical pharmacist?
So a clinical pharmacist is someone that has experience, education, and training in the area of medication. So essentially, it is someone that is an expert in medicines. Um, you could find a clinical pharmacist in a hospital setting, so on your wards, in the pharmacy. You can also find a clinical pharmacist in your GP practice. So he or she is someone that you could go in and speak to your medication about. So they do medication reviews alongside other things. And also community pharmacists. So these are your pharmacists in your supermarkets or your pharmacists on the high street. So they provide medication advice. They give you information on how to take your medication, when to take it, the safest way to take it. So in essentially that is what a clinical pharmacist is.
And that I presume would be male as well. So it will be male and female. Can
Not
you
just,
describe for Can you describe for us your role as a clinical pharmacist?
yeah, so I've been a clinical pharmacist for 5 years, and really I work in a hospital. So I work on the wards. I participate in the multidisciplinary team. So this is a team of doctors, physiotherapists, nurses. We all work together to ensure that the care of the patient is optimized. And what I would do on a day-to-day basis is review the medication treatments for patients. So, for example, a patient has a chest infection, the doctor wants to prescribe a certain antibiotic. What I would do is I would provide advice, but also I would ensure that the medication is safe and appropriate for that patient, and also that the patient knows how to take it effectively. Um,
Mm,
Also, we govern the safe use of medication. So this involves the storage of medications. Um, Literally everything to do with medication, we're involved in it. Um,
mm,
on a day-to-day basis as well, I ensure that the medications are safe, stored at the correct temperatures, that it's stored in the right way. For
mm,
example, medications that are quite controlled because they can cause they're high risk. So those are stored in the appropriate places in cupboards, ensuring that the guidelines are followed in terms of the treatments of different diseases, making sure that the medication treatment are cost effective because we know that the NHS is very expensive, medications is very expensive. So I would sort of interject in terms of cost effective measures. So making sure that the treatments that we give people are not only effective health wise, but they're also the most cost effective in terms of all the medications on the market.
mm. That's so interesting. Very, very involved role, isn't it?
Oh, I
You know,
know.
right. You know, in the daily guidance that the government gives or recently, they declare the world's first coronavirus treatment approved for NHS and immediately authorized this drug, dexamethasone,
Yeah.
um, as the coronavirus treatment to reduce the risk of deaths.
Yeah.
What can you tell us about this drug?
So dexamethasone is actually a drug historically used to treat conditions that can then cause inflammation. So it's historically been used for in cancer. It's been used for respiratory problems, so problems with the lungs. Um, it has a very, very wide use, and it is a drug that is known as a steroid or
Mm,
also known as corticosteroids. And the way it works is that it acts to reduce things in the body that can cause inflammation, because inflammation
mm,
is both good and it's both bad. So it helps in that situation.
mm. Are there any advantages in using this drug?
Yeah, there are some advantages. As I said, it's got a historic use. So we have been using dexamethasone for years and years and years. It's a well-established drug. We have many clinical trials on the medication, and it's used in various expertise. So not just infectious diseases or respiratory problems, but it's been used
Mm,
in many different sort of areas. Um,
mm,
so it's well established, so that's an advantage. We're well aware of the side effects,
mm.
and we're well aware of how it works. So those are benefits for its use.
As you mentioned, side effects. No, that was going to be my next question. Are there any side effects, especially significantly, among people who might have respiratory illnesses?
Hmm.
Presumably that's what it's for, especially. So, are there any side effects?
Yeah, so with all drugs, everything, it has side effects. So in terms of dexamethasone, you can see some side effects based on the long-term use of the drug. So,
Mm,
uh, for example, long-term side effects that people might experience are problems with their eyes, problems with their skin, problems with their bones. But
mm,
these things are monitored, and we would give patients the necessary precautions. So, for example, cover your skin, protect it from sunlight would be one, and with the bone side effect is to take sort of calcium supplements and things like that that will help strengthen the bone. So these are some of the long-term conditions. So people that will be taking dexamethasone for years and years and years. Um,
mm,
but there are also other side effects that is relevant for people such as hypertensives. They
mm.
can increase blood pressure, so they would need to monitor their blood pressure.
Right.
It's
Mm,
side effects for diabetics as well.
mm,
It
mm.
can raise their glucose level, their blood sugars, so they need to monitor these things. Um, so in terms of these patients, it's important just to keep an eye on their underlying conditions whilst they take dexamethasone. In terms
Right, right.
about respiratory side effects, um,
Mm,
there are not really relevant respiratory side effects that are it's all
mm,
very common side effects which
mm.
I don't want to bore people with, but not really. It's mainly sort of the diabetics, the hypertensive patients, um,
Right.
and people in these groups that would need to worry. And that's a good thing about dexamethasone. It doesn't really have any sort of pronounced respiratory side effects. So yeah.
Is it then the million-dollar question? Is it the wonder cure for COVID-19?
Um, I wouldn't describe it as a wonder cure. Nothing is really a wonder cure. um, it's a very good treatment, I would say. So
Mm,
terms of there's a recent trial called the recovery trial that was done in Oxford, and
mm,
they sort of tested people with COVID, and they found that actually dexamethasone, when it was given to patients with that needed respiratory support, so these are patients that needed oxygen
mm,
therapy and patients that needed ventilation, that they needed help breathing, so really sick patients, they found that actually dexamethasone significantly reduced the amount of deaths within these patients. And significantly is very important, because it shows that 1 in 8 people within these group of patients, it will help them, and that's a significant result. So it is a very good drug. It will help people. It has been shown to help people survive COVID, especially those who are very sick. And it's well established. We know about it. And the good thing about this trial is that it highlights that this drug is effective, and it will help people with COVID. So it's a good drug.
Excellent. Well, I'm sure our guests, our audience listening on the replay, or those listening to us now, got a lot of value, because you really gave us some interesting information on this drug. And of course, it helps people to make choices whether or not it's something that they would want to take. What would be your one most important tip somebody listening to you'd want them to take away and act on today?
So what I would say is, regarding the actual medication, dexamethasone, is to, if you do come across, or you're placed in a position where you might have to take the medication or not, you do have healthcare professional, pharmacists, doctors, nurses, who are there to assist you and to give you the necessary information to make sure that the medication is safe to take. The other thing is that it is a established drug, so it's safe, and be tailored to each individual, whether they are appropriate for it, because not everyone will be appropriate for it. And last, in relation to COVID, it would really just be to follow the necessary guidelines that are out there. So washing your hands, maintaining good personal hygiene, protecting yourself and family members from contracting this virus. And really just to follow the government guidelines that have been published in terms of how we should conduct ourselves safely and appropriately during this sort of time.
Thank you so much, Crystal. You just gave us so much value. What you said is so interesting. Would love to hear from you again for other treatments or other drugs. So I'm sure we'll have you back again on our program. For those of us who are listening, you want to just hit the like button or love us if you got value. And if you got value and you think somebody else should get the same value, please share it with them as well. If you've got any questions on the drug and questions for Crystal, please do not hesitate to email us at theprofessionalviewpoint.com. That's the professional viewpoint at gmail.com. That's the address, theprofessionalviewpoint@gmail.com, where we'll get your questions answered. Until next time, see you on the other side. Thank you so much, Crystal. Goodbye.
Bye.
You're welcome.